What I'm going to talk about for the next 25 minutes is about culture, but culture in the context of relationships and how we transform big systems. And what I want to share with you is some work that is very much a work in progress that I've been developing collaboratively with Göran Henriks. And Göran is the Chief Executive of Learning at Jönköping region in Sweden. And you know, between us, Göran and I have got 70 years of experience of supporting large-scale change in health and care in very different contexts. So, you know, mine in England and his in Sweden. And both of us get to work with health and care systems all over the world. But, you know, when you look at things, you know, when we think about what it really takes to make large-scale change happen, okay, radical transformational change happen, I'd say that the basic principles are the same. You know, wherever we are in the world, however different our context is. And, you know, the one thing I would say is transformation is inherently relational. So actually coming and being part of Culture Camp today and talking about the culture of relationships and community systems is absolutely spot on with where our thinking is. So I thought I should start with some definitions. I know many of you were at the earlier session, which was about culture and mindsets. And what I want to do is make a little bit of a segue between that session and the start of this session. So, you know, culture. Okay, it's a pattern, you know, assumptions, beliefs, values that form the basis of people's way of being, relating and working. And one particular point I wanted to make and why I chose this specific definition is that culture, you know, very often we think of it as being an inward thing, you know, the culture of our organization or the culture of our division or the culture of our practice. Actually, culture is outward looking as well. So it's not just about what's going on in the system, but it's about how organizations and teams operate with partners in a wider environment. So what I want to talk about is about culture in that wider system transformation perspective. And of course, you know, it's underpinned by mindsets. It's our conscious and unconscious understandings and expectations around what people hold to be true about themselves, others, and their work. And I'd say that, you know, in my world of large-scale change thinking, I'd say that, you know, very often the biggest blockers are mindsets, you know, the things that people think about change. So maybe we need to think in some different ways. And finally, that impacts on behavior, observable actions. And, you know, at the end of the day, all of us here who work in change and improvement, you know, it's about action to make a difference. So, in terms of the work I'm going to show you now, it's like I said, it's work in progress, and it's part of a series that Göran and I are writing for BMJ Leader. And again, I'll give you all these slides with all these links. And what I want to share with you are the 7 simple rules that Göran and I have developed around how, as leaders, you know, we can create tomorrow today. And I want to say a little bit in this session now about simple rules as an idea for shifting culture and transforming systems on a very big scale. But the first blog that we wrote was about creating simple rules. The second blog that we wrote was about our first simple rule, which is about defining our shared purpose. Okay, and actually our third blog is due to be published tomorrow, and that's about belonging, and I'll share some of that with you. So let's talk a little bit about simple rules, because what I'm going to do is I'm going to share with you shortly 7 simple rules that Göran and I have developed, and we've actually been working on these since 2013, so 8 years, and we've worked with like hundreds of people, people in health and care organisations, people with lived experience, people at the point of care, and you know, we've developed these over a long period of time. So when we talk about simple rules, what do we mean? Well, when you look at complexity science and methods for transforming complex adaptive systems, okay, simple rules is a core idea in that world. And again, I talked before definitionally about mindsets. It's a way of thinking around transforming mindsets that drive behaviors in very large complex systems. So, if we're working in a large system and we want to get a very large group of people across that organization or system to behave differently, and we want everybody moving in a coherent direction towards our goals, there's at least a couple of ways that you can do this, okay? One way we can do this is around having really clear policies and approval processes and governance mechanisms and top-down cascade. And in a sense, everybody's clear about what their accountability is in the formal system, and we hold people to account at every level of the system. Okay? Another way we can do that is by aligning people and systems through simple rules. So what we basically say is, these are the simple rules that underpin the way that we behave and the way that we operate in our system. And everybody is accountable for operating with them with a much higher degree of individual freedom. I'd say the bigger the organization or the system gets, okay, the harder it is to just create that coherence by if you like, approach number one. We need to think more and more about approach number two. So again, this idea, so rather than complying, or maybe as well as complying to sets of rules and policies, okay, we say, what are our simple rules that define how we operate around here, that that underpin our culture, so that everybody understands why and what we're doing. And the thing is that everybody understands these simple rules and delivers them in their own way. So what we're not saying is, this is how you must do it. Neither are we saying, well, we're ripping up the policy book, so do what you like. Okay. What we are saying is, these are the ways that we want to work and express yourself using these elements. So our goal with these simple rules is not to create like a permission culture where we're exercising control, but to actually establish the high level principles within which we all operate. And, I've worked with many teams on creating simple rules. And I think, where we co-produce them, okay, and where we develop them in ways, supported by positive culture, they can be an incredibly effective way of working. So I'm just going to show you a couple of examples. Okay, this is from Oldham, and this is the simple rules for COVID-19 response from Oldham. And again, they could, our colleagues in Oldham could have like a massive rule book around COVID, but actually they had 5 rules. Okay, so rule number 1, keep current with the national guidelines and also the guidelines from the National Care Alliance, of which the local NHS system in Oldham is part. Okay, so keep current with the guidelines. Secondly, defer to experts. So, listen to the scientists. Number 3, coordinate and do things in a meaningful way. Don't confuse. Okay. Number 4, keep calm. And number 5, stay kind. I think that's a really rules, and everybody knows that's what we have to do, so we don't have to write pages and pages of policies, because we know that's what we have to do. Let's think about simple rules in the context of my world, if you like, on thinking about change. And here I've got a set of 8 simple rules, and where these come from is Don Berwick, who is a leader, a global leader of improvement, who's based in the USA. He collated a whole series of fantastic speeches that he had made into a book called Escape Fire. And then the person that wrote the foreword to his book, who is Frank Davidoff, what he did, he went through all of these speeches in this book, and he pulled out the 8 key points. And if you like, these are the simple rules. So when we're trying to, design health and care system in the future, okay, here are some simple rules. Number one, name the problem that we're addressing. Number two, focus on strengths and build on successes. Number three, take leaps of faith. Number four, look outside of health and care and outside of medicine. Number five, set clear aims and show constancy of purpose. Number six, focus on systems and seek to understand them. Number seven, make action lists. And number eight, never ever lose sight of the reason why we're doing this and the patient as a central figure. So they're two very different contexts, but I hope that gives you a sense of what simple rules are about. So here are the 7 simple rules that I've developed with Joran. And again, it's about, for leaders, what do we need to do to transform our system, okay? Based on evidence, both evidence from the research base, but also based on evidence from decades of practice. And what I'm going to do in my little talk now is I'm going to take you through the first 2 in a little bit more detail. And then I'll take you, and then I'll talk a little bit about most of them, but only in a fairly superficial way. So let's start with these. Maybe before I start, I should say something about COVID. People think, wow, COVID has changed our world so much, and I completely get that it has, because we see so many things happening across our systems that we couldn't even have dreamed of happening a year ago. But when you look at COVID and the response to COVID and the innovations that have come about as a response to COVID, what we can see is that actually many of those responses and new ways of working as a result of COVID were actually things that were happening in the system already. Okay, but what COVID brought about was a speeding up, a turbocharging, and amplification. So in a sense, what I'd say is that we're in a world that was already moving very, very fast in terms of change. COVID came along, okay, and massively amplified that. And when we think about the tomorrow, that we want, beyond pandemic, beyond lockdown, okay, it's going to still be moving very, very fast. So actually thinking about, the ways that we can engage and mobilize lots and lots of people in change, I think is one of the best responses to COVID in creating a different tomorrow that we can make. So let's start. So let's start with number 1. Okay, number 1 is in terms of our 7 simple rules, is about defining our shared purpose. All three words. So why do we want to focus on shared purpose? Well, here's a quote from Seth Carguilio, and it really sums it up to me. He says, shared purpose goes way deeper than vision and mission statements. Okay, shared purpose goes right into your gut and taps some part of your primal self. I believe that if you can bring people with similar primal purposes together and get them all marching in the same direction, amazing things can be achieved. Okay, so when we're thinking about, working together, understanding that transformation is inherently relational, actually taking the time and effort at the beginning to focus on shared purpose, I think is one of the most important things that we can do. And, when we think about our world, our increasingly complex, uncertain COVID world, actually shared purpose becomes even more important, because the things that we do, in our complex systems might be different. But if we've got shared purpose, then we move forward together. And it was fantastic listening to Jacqueline earlier, and how in the leadership capability model, she talked about the role of social justice. Okay, I absolutely get that. And here's Prerna, our Chief People Officer, and she's saying, we have to reconnect our health and care actions back to the shared purpose at the founding of the NHS, back to principles of social justice. And I think, for any of us that are doing large scale change work, we've got to focus back and anchor it in social justice. You know, the equal worth of all our citizens, their equal right to meet their basic needs. Okay, the need to spread opportunity and life chances as widely as we can, and the requirement that we reduce and eliminate inequalities in our system. So whenever we're thinking about a shared purpose statement, okay, it isn't just about, you know, having some nice statement on a piece of paper. It's really connecting back to those, you know, the things that really matter to us. So, you know, what I'd say in terms of creating our shared purpose, we need to think about all three words. Okay, we need to think about the hour. You know, who is the hour? Very often, you know, when you work in healthcare improvement, people say, oh, you need to have, you know, you need to have an aim before you start. The first thing you have to do with your improvement project is have an aim. I don't agree. I think aim is the second thing we have to have. The first thing we have to have is an understanding of who are our people. Okay, because if we don't know who our people are that we need to engage, and we don't have them co-creating the aim, then it's going to feel like change is pushed on people, not created with people. So the first thing we have to do is think about the hour. And this little diagram I've put here, you know, we can think about this at two different levels. There's one level for a transformation effort or initiative where we're bringing people together for the first time. It's slightly different when we're thinking about our shared purpose for a team in an organizational system where the boundaries are kind of clear and people have existing relationships. So I'm going to focus on the top line here for a transformation effort or initiative. So you know, who are the people who will be impacted, who needs to be part of the change, and who has got the power to make change happen? Because we need, the hour needs to be both, needs to be the people who will be impacted and the people that have got the resources, you know, and the authority to make things happen as well. Next word is shared. You know, and the thing about shared is we come from many different backgrounds. We've got diverse views. We've got unequal levels of power and privilege. But beyond that, okay, what is it that unites us, that brings us together for change? And then finally, we have purpose. Why are we taking action? Okay, how does this action that we're taking connect to the things that really matter to us? So again, you know, when we think about what Prana said with social justice, we think about you know, this primal connection. Okay, and one of the biggest mistakes people make when they're trying to do purpose statements is they write an aim. You know, our aim is to reduce waiting time for patients, or our aim is you know, is to improve quality and reduce costs. That's not an aim. It is an aim. That's not a purpose. Okay, a purpose is at a higher level that connects with what really matters to people. So just going to give you an example of one. This was a campaign called End PJ Paralysis that I know many of you you know about, but it was a campaign where people were lying in hospital beds and care homes beds, you know, people, particularly people aged 80 and over, and they were being deconditioned by the fact they were immobile in bed. And it was making a massive impact in terms of whether people could have the life choices they wanted beyond being in hospital or being in the care home. So this idea of ending pajama paralysis was to get people out of their pajamas and get them mobilized as quickly as possible. And it was a fantastic nationwide campaign, and 710,000 hospital days were saved, which is great. But actually the impact on people's lives and the choices it gave to hundreds of people, I think, was even more important. So just as an example, here's a shared purpose statement for End PJ Paralysis. So who are the hour? Okay, it's you know, patients, the people in the beds, okay, nurses, families, physios, leaders, doctors, care assistants, students. Okay, what unites us, you know? What do we share? Actually, what we share is anger and outrage at older people deteriorating when we've actually got the power to do something about it. So what's our purpose? To make sure that every person in the hospital bed gets mobilized when they're ready, both clinically and personally, and that every person gets choice and a chance for the future life they want. Okay, and again, you know, being able to mobilize people quickly can make a huge difference between whether somebody has to go into a supported care setting, or they can keep their choice of staying independent at home. So you get a sense of that. Okay, number two. is about rooting our transformation efforts in a sense of belonging. And again, belonging is a really big theme today, because earlier we heard from Lenny talking about how important focusing on that sense of belonging is when we're talking about equality, diversity and inclusion. And Jen is going to come on and talk about belonging as well. So just some things to think about in terms of belonging. For when we're doing large-scale transformation efforts. Okay, Joran and I get asked to look at a lot of transformation plans, place-based transformation plans. Okay, and it's great to see these, but what's interesting, many of the transformation plans that we get to look at are the demographics belong to a certain place, and you can tell that the demographics are underpinning this particular transformation plan. But apart from that, we could be writing a transformation plan for anywhere. And so if we are going to create place-based transformation plans, they need to be based in a sense of belonging. What's the essence, the ness of your place and community? Okay. How are you bringing out the sense of belonging to that place? So I live in Coventry, so I just put an example here. What do we know? What's the essence of Coventry? Well, people in Coventry are very resilient. When you look what happened in the Second World War, we kept going. It's a very diverse city. People work very hard. It's a highly innovative place. We've got 2 world-class universities and world-class centres of automotive practice. And think about Lady Godiva on her horse riding naked around Coventry. It's because of unfair taxes. So it's a place that's always been about fairness and justice. So when we're creating a transformation plan for a place, we need to get everybody to think about that place and what the characteristics are. Okay, what makes me connect with it, and build our transformation plans around those things. And then at the second thing I wanted to show you, I'm running out of time, so I'll just show you this. Okay, when we think about belonging, and again, Jen's going to talk about this topic much more than me. Increasingly we're seeing this focus on belonging, and when I think maybe even 18 months ago, in my improvement work, wasn't focused on belonging. Okay, now I'm so focused on belonging, because we know, feeling that we belong makes the biggest difference in our ability to enable change. But working to make people feel they belong isn't enough, because we can make a lot of effort around belongingness, but unless we also support and cherish the unique things that everybody brings, okay, then what we end up with is assimilation, which is the bottom right-hand corner there. Yes, I'm in the gang, but I can't be myself. Okay, I have to be guarded. And what we truly want is inclusion. I belong, I can be myself. So the efforts and the way that we go about creating a climate for inclusion, we think about the practices we need, we think about how we operate as leaders. So we're valuing both belongingness and uniqueness. I'm about to run out of time, so I'll just maybe show you one more thing. I'll just show you this thing. Okay, number 7. I think one of the most important things that we need to do is yes, we're making small-scale changes, and the thing about large-scale change is actually large-scale change is actually loads of small-scale changes, and we need to be making our small-scale changes within a large-scale framework. And when I look across the NHS and the wider health and care system, and the places that I see doing best at innovation and improvement is where they've got a large-scale innovation framework for change, and all the small-scale changes are taking place within that. And it's amazing, when I go and work with integrated care systems, sometimes we'll do a kind of a survey of all the different initiatives that are going on in that ICP system, but it's like 1,000 flowers blooming. Okay, there's loads and loads and loads of little initiatives which are great, because little initiatives change the world, but they're not all linked up, so we're losing the power of them. So maybe I'll end by just with this quote from David Fleming, and he says, large-scale problems, okay, and when you think about the large-scale problems we have in health and care, they don't require large-scale solutions. they require small-scale solutions within a large-scale framework. And then really finally, I just want to end by giving a plug. If you like these ideas, my team, which is NHS Horizons, we run a school called the School for Change Agents, and 100,000 people have been through this. And it's starting again in April, and it's free. And if you're interested in the school, you just go on to horizonsnhs.com/school. And I'll end there.